Hello everyone. Today we will discuss about an interesting topic called as pre-diabetes. So many of the individuals will go for routine health checkup, and in that sometimes they will get HbA1c test done, and few will range in between 5.7 to 6.4% of HbA1c. This value we consider it as pre-diabetes stage. So usually the chain will follow this pattern to develop diabetes mellitus. That is, initially there will be normal glucose tolerance test. If we do glucose tolerance test, it will be normal. After that, few people will start developing transient impaired glucose tolerance. So once we do the test, some values will be normal range, but sometimes they will have abnormal impaired glucose tolerance. After next stage, they will have persistent, the impaired values will be persistent for many readings. After that, it will lead to diabetes mellitus development. So pre-diabetes is this phase we can consider, that is transient and persistent impaired glucose tolerance phase. So what is the mechanism for pre-diabetes development? It is same as diabetes, that is initial hyperinsulinemia will be there. After that, slowly there will be dysfunction of the beta cells. So what are the risk factors? As we know, there are modifiable and few non-modifiable risk factors. Among non-modifiable risk factor, important is genetics. So this will play 30% role in the development of pre-diabetes. Whereas in modifiable risk factors, important things are central obesity and physical inactivity. So these are the risk factors. And what is the percentage of people who will change from pre-diabetes to diabetes as seen in the chain of this particular condition? That is, every year it is 6% of the people who will get converted to diabetes, evident diabetes from pre-diabetes. And coming to the prevention of this one, like how to prevent a person developing diabetes when we detect him in the pre-diabetes stage. So they have done many randomized control trials and studies. From those studies, we got the evidence that if we don't intervene with anything, then there will not be any chances of reduction, any chances of prevention of developing diabetes from pre-diabetes. So that is the effect of placebo we can consider. Then if we use metformin in pre-diabetes stage, there is chances of 38% reduction. That is, 38% chances are there to prevent development of diabetes. Whereas lifestyle modification, if we consider, it will have a very big impact. That is, about 58% reduction can be seen. But lifestyle modification will be a bit financially burdening, especially in countries like India. So we can go ahead with the pharmacotherapy, that is metformin, along with some efforts towards the lifestyle modification. What best advice we can give? As I told at the beginning, if a person gets routine health checkup and he gets the value of HbA1c in this range, and if we consider him as pre-diabetic, we can advise him few best things. That is, he has to undergo modest weight loss, that is at least 2 kg in his body weight is advised. Then some modest increase in the physical activity, at least 30 minutes of moderate intensity exercises he has to do every day. So as we have seen in the risk factors, mainly modifiable, that is central obesity, for that we will target weight loss, and for physical inactivity we have to advise for at least 30 minutes of exercise every day. So this is about pre-diabetes. Thank you.